Today we're going to be talking about occupational health nursing. We have a key informant, Holly, who actually had an experience at her hospital with an occupational health nurse, and to help with my discussion about this today I have Hannah and I have Kevin. But first we're going to jump into the interview with Holly real quick, and then we will come back and discuss.
Hello, my name is Catherine. I'm a Madonna University student, and I'll be talking to you today about your experience with occupational health nursing. My key informant is...
My name is Holly. I've been a nurse since 1985, and I currently work in a small community hospital in the recovery room.
Okay, so what occurred at work to put you in contact with your occupational health nurse?
We have telemetry units that are hanging beside the bed. They have long cords. The cords are on the ground, and as I adjusted an IV behind someone's bed, I started to walk away, and it tripped me. And as I was falling, I grabbed the bed and I twisted my knee, injuring my meniscus.
Do you think that this could have been prevented with a policy or any
Yes.
other?
We have since made it to where we roll up our cords and have a Velcro strap that was never available before.
Okay. Before this happened, did you have any education about occupational hazards or OSHA?
We always go through safety videos every year. They're pretty basic about back safety and lifting, not specifically in our department about cords on the floor. It has been a trip hazard for a while, and other people have tripped over them. I just happened to get injured where I needed care.
So tell me about the injury and the health nurse.
When you're injured at work, they send you first to an ER or an occupational medicine clinic who's in touch with then the occupational employee health nurse. She will then decide if you need further care on what that initial evaluation. She did decide I needed to see an orthopedic doctor, which they picked for you, and I went there. She's a liaison then between the doctor and your boss, so that you aren't always, the boss doesn't get your private HIPAA information. She just tells the boss you can or cannot work, or if you need restrictions based on what the doctor tells her. So every doctor's visit was reported back to her and what they found out, and she then decides with that, your physician, if you can go back to work. I ended up needing surgery. So they had a nurse navigator who is someone that's assigned to a patient who's got a work-related injury that goes and makes sure you're getting the proper care, that you get the proper follow-up. She goes with you to the doctor's visits, and she, the nurse navigator, and the occupational health nurse work together just to make sure you're getting all the proper resources, and then they find, they talk to your boss, and kind of keeps you honest in a way, but it also makes sure you're getting the right care so you can't come back to work early because you want to come back to work. If the doctor says you can't, you can't. But it also keeps people, if they want to stay and say, oh, I need another 2 weeks off. If you don't need it, you don't get, you won't get it approved. So she keeps the employees covered well, organized care. She also makes sure that you are doing what you're supposed to do. If the doctor says you have to go to physical therapy, she makes sure you go to physical therapy and things.
What kind of paperwork did you have to complete regarding your incident?
After I hurt myself at work, I called the house supervisor, and she told me to go on and fill out the accident incident report that's on our computer. Every hospital I've ever worked at has their own form, but it's basically the same, that how the injury occurred, if it could have been prevented, if you have an injury, if the doctor saw you. That information is sent then to the occupational medicine nurse so that she can follow up, send you to the clinic, or just, I have hurt myself and other people have hurt themselves and not had to have care, just a minor thing. She deems whether or not you need to follow up with a doctor. That then goes into like an OSHA database so that they know how many things like that have happened. Like, let's say somebody's electrocuted by a piece of equipment, you take the piece of equipment out of service. That's why these records are there, to keep people safe and so that it doesn't keep happening.
So you missed work.
I did.
How long were you off of work?
6 weeks.
Did they give you any resources or workman's comp? Any kind of
Yes,
funding?
because it was a work-related injury.
Okay.
I did get covered under workman's compensation, which did not take out of my vacation time and so forth. She also organizes that, makes sure that the information gets to the proper people that pay you, how long you're going to be off and so forth. So yes, I got part of your wage is covered.
What other kind of work-related incidents would require someone to visit the occupational health nurse?
If you have a exposure to body fluids, if you get something in your eye or things like that, they are the ones that you would go to for follow-up care to see if you need any kind of prophylactic medicines for patients that might have hepatitis or HIV. Needle sticks are always followed by her. They test the source patient and you, and they follow up again with hepatitis and HIV contaminations. If you cut yourself at work, we had a girl in the OR who cut herself on a scalpel who came to me in the recovery room. I wrapped her hand, sent her to the ER. She got stitches and then had to follow up with the occupational health nurse to get her tetanus shot and then later to get the stitches out.
Okay. And based on your experience, do you feel that occupational health nursing is an integral part of the healthcare team?
Yes, because besides helping employees that are injured at work, she makes sure that vaccines are up to date, TB tests. If you have some sort of a disability, she makes sure that those things are available to you at work. If employees have problems with latex allergies, she gets the order through for the right kind of gloves, make sure they're on your unit for you. If you need special, like a wheelchair, if you're a wheelchair-bound employee, make sure that those kind of things are available to you. So she is somebody that organizes basically the health of all the employees in the hospital.
Okay. Thank you for your story and thank you for your time.
Guys, so after watching that interview, I just think that it's ridiculous that especially nurses have to go to work still and worry that they're going to come home hurt. Because Healthy People 2020 is in place and it's such a big thing right now, and their goal is to prevent things like what happened to Holly. And I just think it's crazy. And Kevin, I know that you've done some research on like OSHA and stuff. Is there a way that this lands on the nurse? Like it's her responsibility?
Well, I think the first thing that we need to recognize is that there's no way you're going to get rid of all risk and all injury and all illnesses, right? So, but the whole point of having programs like the OSHA and all these different organizations is to try to mitigate and reduce the likelihood of these incidents kind of happening. So, when we talk about the roles and responsibilities of the occupational health nurse and the nurse that's involved in these sorts of incidents, the first thing that they're going to do is they're going to kind of evaluate the situation, right? So the occupational health nurse is going to get their work history, right? What are their duties? What are their responsibilities? What kind of risks are involved in their work environment? Because everything has an inherent risk to it. It's all about, the risk versus reward kind of thing. And these things are going to be needed to, for fitness of duty evaluations, so if a person goes off work, workers' compensation, when can they go back to work, what can they do when they go back to work, right? So they're going to have to get a detailed report on these things. So when we were looking at the video, talking specifically about the nurse that got injured, they're going to want a detailed history of how it happened, what were the circumstances, who was around, what was her duties and responsibilities, was she doing everything that she was supposed to be doing, right? Wearing the proper PPE and all these different kind of things. So, these are going to be a lot of the different things that we're going to all put together to try to mitigate and reduce these risks.
Right, and you actually mentioned a lot of things that relate to the intervention wheel that has been drilled into our brains in community. You mentioned outreach, so Holly actually contacted the occupational health nurse directly after the incident happened, and they did the disease and health event surveillance. They took her to the ER. They asked her, what happened? Tell us about the scenario. What your environment was like. She talked about surveillance, how they have the training videos. once a year, but it doesn't really touch on fall risks. It's mostly the needle sticks and the back injuries, which are also very common nursing injuries. And then it also touched on screening, which is, someone going onto the floor that Holly works on and looking at the different rooms and making sure that there aren't the bundled wires directly next to the bed to prevent that.
Well, speaking of bundled wires, healthy people directly associated occupational health risks, especially in hospitals with the increasing technology that we have. So think of like when we go into a room, there's all these wires. There's the monitor hooked up to the patient, to the wall, to the plugs.
Well, when you're talking with the OSHA and the community health, really any occupational health type of nursing, they have what's called the hierarchy of controls, right? It's a 4-part pyramid. At the very bottom, it starts off with PPE, right? So wearing goggles, wearing gloves, wearing gowns, all that kind of good stuff. The next step up would have been administrative controls, right? Limiting access to a particular area, making sure you have key cards and combination locks to get into medication rooms and things like that. In this case, where she tripped over the wires, we're going to be looking at engineering controls, right? So we're going to change the physical structure of the environment, right? So maybe we're going to tie up the wires. We're going to make sure that we have clear paths to walk with, so there's not the wows, the computers, the there's not stuff all over the place, right? Making sure that the area is free of clutter, that sort of a thing. And then the highest level of the pyramid is obviously elimination. If you can eliminate the risk altogether, that'd be great, which would be eliminating the cords. Technology hasn't really got to that point yet where we can do that at large scale, so that's where we're at the top of the pyramid right now, is the engineering controls, where we can kind of get rid of or at least mitigate people tripping over things on the floor at the very least.
And like you mentioned, fortunately, with Holly's place of work, they actually did implement a policy to use like a Velcro strip to put up the wires to prevent busy nurses who are busy working on their patients and busy checking monitors, giving medications, don't have to worry about possibly tripping and falling and injuring themselves.
And that really reflects the goal of Healthy People 2020. It's to prevent and promote health in the occupational workplace.
And I think it's important that we consider the occupational health nurse's role, because she's the one that will listen to the story. She's the one that will bring this incident to administration, people higher up that can actually do something, implement policies, and she's the one that will refer Holly. Well, maybe you need to see PT, because she did hurt her meniscus, which is a severe injury that could really damage her career and possibly end it. So she's responsible for making sure Holly is able to get back to work, and when she comes back, that it's safe for her.
And that's so important, because working is one of the social determinants of health, especially as somebody who cares for people who need to be healthy.
Yeah, and that ties into, you mentioned the medical surveillance, so, and the medical screening kind of stuff, and so that's another very important part that, even if we, couldn't mitigate or reduce the risk, for this particular incident, we can prevent future ones later on by doing these medical screenings, right? So we're going to take all the screenings from all the employees that get injured in the workplace, right? Maybe she isn't the first person that's tripped and fell, she just wasn't injured, right? So is that documented properly? You know what I mean? Any kind of incident like that. So just because that somebody isn't injured doesn't mean that the risks aren't there, So that's part of the surveillance program, is to take all the information that we've gotten, and that way we can identify these things before somebody really gets injured.
Right. Definitely agree with that. Alright, so I think we had a really good discussion about the interview with Holly, and we touched on OSHA regulations, Healthy People 2020, and the intervention wheel, all to tie into how we can maybe prevent future workplace injuries and how occupational nurses have a role in preventing them. So, what do you guys think?